Okay, so today we will start with chicken infectious anemia. So, chicken infectious anemia is an important viral disease of birds which are responsible for immunosuppressions, and this will lead to really huge economic losses to the poultry farmers. This chicken infectious anemia virus is also known as anemia dermatitis syndrome because this particular virus are responsible for anemia as well as dermatitis. They are also known as infectious anemia syndrome, hemorrhagic syndrome, or blue wing disease. Particularly, last two synonyms are related to hemorrhages that occur into the different subcutaneous tissue as well as inside the muscles. And due to this hemorrhage, you will find slightly bluish discoloration over the skin, and this is the reason why the blue wing disease name was given. So, chicken infectious anemia is a viral disease of young chickens, particularly between 1 to 3 weeks of age, because this particular age is most susceptible for this virus, and generally when they do not have their maternal antibodies for the protections, and this is characterized by aplastic anemia. The name itself indicates aplastic anemia, aplasia. Generally, we have already learned these terms in cellular adaptations and generally some developmental problems, right? So aplasia, generally what it means, generally there will be no development of that particular organs, and this aplastic anemia, this aplastic word is also related to aplasia, means when there is no proper development of bone marrow cells, or you can say due to severe apoptosis of the bone marrow cells, ultimately it will leads to anemia. So generally this particular virus is responsible for apoptosis of a precursor cell of a bone marrow, and this will leads to severe anemia, as well as this particular virus is also responsible for generalized lymphoid atrophy, because this particular virus replicate inside this precursor T lymphocytes of the thymus as well as in the bone marrow, and ultimately it will induce apoptosis. So generally you will find generalized lymphoid atrophy, hemorrhages, as we have already discussed. Due to aplastic anemia there will be decreased platelet count and ultimately thrombocytes particularly, and you will find severe hemorrhages, and due to severe atrophy of lymphoid organs, ultimately you will find severe immunosuppressions. And due to severe immunosuppressions, this such type of birds are frequently infected by secondary bacterial, viral, or fungal infection. This particular disease was first time identified in 1970 in Japan. But then after now this particular disease is a worldwide ubiquitous, you will find in any part of the body, and in some recent articles this particular virus is also identified in fecal material of dog as well as in some human patient also. So etiology of this chicken infectious anemia virus is responsible for development of this disease. This is single standard DNA virus, belongs to genus Gyrovirus family, Anneliviridae. So here you have to remember this thing. In past, this particularly chicken infectious anemia virus was actually classified into family Circoviridae because this particular virus have circular DNA. But in recent 2018 or probably 2017 classifications, this virus is now classified into another family known as Anneliviridae. So as we have discussed, this particular virus have circular DNA. So initially it was classified into Circoviridae, but now due to recent classification the family is changed. This particular virus have three important viral proteins which are responsible for their pathogenicity: viral protein 1, viral protein 2, viral protein 3, and among this viral protein 3 are most important because they are responsible for apoptosis of the cells in bone marrow as well as in thymus. So viral protein 3 are most important, which are responsible for disease production, particularly induction of apoptosis in the different cells where these particular cells are replicate. So ultimately viral protein 3 are main pathogenic proteins in this particular virus. And this particular virus are among the smallest DNA viruses. Now host. Generally, for chicken infectious anemia virus, chickens are only known host for the disease. There are some other circoviruses are identified which are responsible for disease in other birds, but this particular virus are responsible for disease in chicken only. Generally, all ages of birds are susceptible for infection, but generally the birds which are between 3 weeks of less than 3 weeks of age are generally more susceptible, and they will show severe anemia and other clinical signs, particularly the birds which do not have maternal antibodies. So birds which are lack in maternal antibody, and if their age are less than 2 or 3 weeks of age, then they are highly susceptible for infection of this chicken infectious anemia virus. Generally, elder birds are can be infected, but generally they do not show any type of clinical signs. Now, transmission. So this particular virus is transmitted by both the way horizontal as well as vertical. So if we discuss first horizontal route, generally fecal oral route is a prime route for transmission of this disease. Generally, this particularly chicken infectious anemia virus have very high affinity for precursor T lymphocytes of the thymus and hemocytoblast of bone marrow cells. But apart from that, this particular viruses also replicate inside the duodenum, some respiratory tract as well as in kidney. And this is the reason why this particular virus is secreted into the feces, and they become source of infection for other healthy birds. This particular virus is also present in the embryo. So there is a particularly embryonated egg. So we can say this particular virus is also transmitted vertically. So this particular virus is transmitted horizontally as well as vertically. Now we will see regarding pathogenesis. So either through horizontal route or through vertical route, initially virus will enter into the body, and we have already discussed particularly the chicks less than 3 weeks of age and they do not have maternal antibody are mainly susceptible for this particular virus infection. And when this all these requirements are met in particular birds, in that case this particular chicken infectious anemia virus will reach into precursor T cells of lymphoblast, particularly precursor T cells means lymphoblast of the thymic cortex, and in hemocytoblast of bone marrow. Right? So hemocytoblasts are again precursor cells which are responsible for production of all three cell line, RBC, WBC and platelets. Right? So generally this particular virus will replicate inside the lymphoblast of the cortex as well as hemocytoblast of bone marrow. As well as this particular virus will also reach into other lymphoid organs like spleen, lymphoid associated mucosal associated lymphoid tissue as well as in many other organs, but the prime replications occur in these two cells mainly. And we have already discussed that this particular virus have three important viral protein 1, 2 and 3, but among them viral protein 3 is the most important, and this viral protein 3 is responsible for induction of apoptosis in these particular two cells. Right? So due to this virus replication inside the lymphoblast and inside the hemocytoblast, after replications this particularly viral protein 3 will induce apoptosis in these two particular cells, lymphoblast and hemocytoblast. So due to apoptosis, you can easily imagine that there will be no production of T lymphocytes, as well as the entire bone marrow, the main precursor cells will die. So ultimately there will be no production of erythrocytes, white blood cells as well as thrombocytes. So due to decreased production of erythroblast, ultimately you will find severe anemia. So there most of these birds, the entire body become pale in color. You will find the normal redness of the mucous membrane and other part of the body will be lost due to anemia. Then due to decreased WBC count, the normal immunity will be decreased, and ultimately these birds are susceptible to many viral, bacterial or fungal infection, as well as due to decreased thrombocyte count. These birds will show frequent hemorrhages, and such type of hemorrhages are easily visible on gross pathology. You will find widespread hemorrhages that involve wings, legs or subcutaneous tissue or breast muscles. And when this anemia become more severe due to decreased production of RBC as well as due to severe hemorrhage, in that case birds will go towards death. But many a time, if immunity is developed, in many a time when this virus load is viral is not much pathogenic, in that case immunity will be developed, and slowly when this antibody is developed, ultimately this virus get neutralized. In that case, slowly again this bone marrow cells will be repopulated with the RBC, WBC and thrombocytes, and ultimately birds can become normal, and generally it will take almost 32 to 36 days. Now, clinical signs. We have already discussed that this particular virus are responsible for apoptosis of hemocytoblast, that we have already discussed in this pathogenesis, right? So hemocytoblast of bone marrow. So due to this apoptosis of hemocytoblast, there will be no production of erythrocyte, white blood cells, as well as thrombocytes. So generally you will find severe anemia. The combs and this particularly combs are become very pale in color. Entire body will become pale in color. And if you go for clinical pathology, the hematocrit will be less than 27%. In normal healthy birds, you will find it will be up to 35%, right? In normal healthy birds, but generally in affected birds, generally whenever you find less than 27% hematocrit, you can say okay, this is suffered from anemia. As well as in clinical pathology, you will find leukopenia as well as thrombocytopenia. And due to severe leukopenia, the immunity will be decreased. Ultimately, birds become immunosuppressed. In that case, you will find secondary viral or bacterial infections, particularly Murray's viral disease or reticuloendothelial virus, or some other viral infections can also be possible, and ultimately you will find similar lesions when they are infected with other viruses. So here you can see this is a cheek, very young cheek, and here you can see this is a wing, and wing are showing severe hemorrhages. So when a hemorrhage occurs beneath the skin, generally within very short period of time there will be blue discoloration occurs, and many a time by the name given blue wing disease. Here you can see this is more better picture where you can see this is the wing, right, and just beneath the epidermis, particularly beneath the skin layer in subcutaneous tissue, you will find ample amount of hemorrhage, multifocal to coalescing hemorrhages, and this particularly hemorrhage are when they become slightly older, or 1 or 2 days after, it will showing slightly bluish discoloration of the skin, so the name given blue wing disease. Here you can see another sites where you will find such type of bluish discoloration due to hemorrhages. Now, gross pathology. So grossly, we have already discussed that the main this particular thymus and bone marrow are prime targets for this particular virus. This virus are replicated in this site, so ultimately they will induce apoptosis of the cells in thymus as well as in bone marrow. So the main pathological lesions are seen in these two organs mainly, as well as due to thrombocytopenia you will find widespread hemorrhages over the different organs. So generally whenever you examine the bone marrow, generally you will find fatty or pale bone marrow, right? So generally what happen in healthy birds, when erythropoiesis occurs in normal low levels, at that time HB concentration is comparatively normal, so it will give typical reddish look to the bone marrow. But here what happen, hemocytoblasts are get affected. In that case, it will viral protein 3 are induced apoptosis of the hemocytoblast, so there will be no production of erythrocytic progenitor erythrocytes as well as WBC as well as thrombocyte. In that case, this entire bone marrow have a very little amount of cells, and in that case generally the bone marrow are filled with the fatty tissue, so you will find ample amount of fat in bone marrow, or sometimes it become pale in color. Then you will find severe thymic atrophy, as we have already discussed. This particular virus is also replicate in the thymocytes, particularly precursor T lymphocytes, which are responsible for production of T lymphocytes. So generally this virus will infect such type of cells, replicate inside the such type of precursor T lymphocytes, lymphoblasts particularly, and ultimately it will induce apoptosis. So due to this apoptosis, ultimately there will be no production of T lymphocytes, and this will lead to atrophy of a thymus. As well as this particular virus are also responsible for induction of atrophy of the bursa, And due to thrombocytopenia, you will find hemorrhages over the various organs, and this includes proventricular mucosa, subcutaneous tissue, skeletal muscles of the body. So here you can see this is the open birds, particularly young chicken, right? You can see this entire carcass is become pale in color, right? The normal slight reddish appearance is completely lost due to severe anemia, as this particular virus are replicate in the hemocytoblast, and ultimately there will be no production of RBC. So normal reddish color of this carcass is gone, and this entire become pale in color. Here you can see this is a breast muscles, and you will find severe hemorrhages, multifocal to coalescing hemorrhages that involve a major part of this muscles. Here you can see again this thigh are showing hemorrhages. Again here also you will find multifocal hemorrhages. Okay, and this is another beautiful pictures that showing normal as well as abnormal blood and bone marrow, right? So here you can see this is a completely healthy bird. This blood and bone marrow are from healthy birds, and this is from affected birds. So you can easily spot the difference, right? So this is very dark in color due to increased due to high amount of hemoglobin concentration, while this has become very pale in color. This has become watery due to decreased RBC as well as hemoglobin concentration, right? So generally in infected birds you will find severe anemia. The blood become watery due to decreased RBC as well as hemoglobin concentration. And here you can see this is bone marrow. In normal healthy birds, due to normal RBC productions, normal erythrocyte productions, you will find typical reddish discoloration of the normal. You will find typical red color marrow. But in this chicken infectious anemia virus, this particular viral protein 3, which are responsible for apoptosis of hemocytoblast, so there will be no production of RBC as well as WBC as well as platelets. So ultimately the entire bone marrow space are filled with the fat only, and there will be no any hematopoietic cells are present. So ultimately there will be no production of RBC. In that case, RBC numbers are decreased, and this will give typical watery, very pale color, very pale blood. Another, this is beautiful pictures taken from this particular article. And here you can see these are the actually atrophied thymuses, right? So generally thymus have, but they are located into the neck regions, and then generally they have total 7 lobes. But here you can see this is very difficult to spot such type of thymus, because they get severely atrophied due to severe apoptosis of a precursor T lymphocytes. Yeah, this is another picture. This is actually neck portion, right? And here also we are unable to appreciate that particular thymic lobe, so it will show very severe thymic atrophy. And this is another beautiful pictures where you can see this is bone marrow, and this entire bone marrow is become pale in color due to severe loss of hematopoietic cells, particularly erythroid progenitor erythroid cells, as well as this entire bone marrow is replaced with the fatty tissue. Now microscopic changes. So microscopically, again same, mainly 2 organs are more severely affected, particularly thymus and bone marrow. So generally in bone marrow you will find severe hypoplasia due to severe apoptosis of hemocytoblast precursor cells, which are responsible for production of RBC, WBC and thrombocytes. So ultimately what happens, this entire hematopoietic cells are lost, so you will not find much cellularity, and generally entire marrow space are filled with the adipose tissue as well as some proliferating stromal cells. Then in case of thymus, again you will find severe lymphoid depletions. The cortex and medullary demarcations are not much clear. Most of this cortical tissue are showing severe apoptosis, so entire thymus becomes small in size, and you will find severe lymphoid depletions. As well as such type of lymphoid necrosis and depletions are seen in also in other organs like bursa, spleen, and some other mucosal associated lymphoid tissue. In some cases, particularly in mononuclear cells, mononuclear inflammatory cells, you will find typical eosinophilic intranuclear inclusions. In some cases, not in all cases, in some cases, particularly some mononuclear cells, of the thymus, spleen, bone marrow, pursa, and lung will show typical eosinophilic intranuclear inclusions, and probably they are the exact nature of these inclusions are still not completely elucidated, but these are probably viral inclusions. So here you can see this is microscopic picture of liver which is taken from this particular article, and here you can see this is one mononuclear cells which are showing very prominent intranuclear inclusions, right? So here you can see this particularly mononuclear cells in livers are showing very prominent intranuclear inclusions, right? And another thing, particularly generally all such lesions are generally seen in particularly very young birds before the development of antibodies, right? So in some cases when birds have a good immunity and if they survive initial period, in that case slowly and slowly this particularly antibodies are developed, it will ultimately neutralize the virus. In that case, due to neutralization of this virus, slowly and slowly this hemocytoblast will again get multiplied. It will start the productions of RBC, WBC, and thrombocyte in bone marrow. So slowly and slowly, proerythrocytes and other hematopoietic cells are slowly and slowly increased in the bone marrow, and entire bone marrow will become completely normal between 24 to 32 days post infection, and such type of birds will become completely recover. Now diagnosis. So based upon clinical signs, generally whenever you find very pale carca, pale combs, and whenever you find some hemorrhages in subcutaneous tissue, they are generally indicative of this particular disease, particularly very young birds, less than 3 weeks of age. They do not have maternal antibody. In that case, clinical signs are suggestive of this disease. Gross and macroscopic lesions, particularly whenever you open the carcass, whenever you find hemorrhages in the different part of the body, particularly muscles, skeletal muscles, as well as whenever you find severe pale bone marrow and atrophy of the thymus, generally they are suggestive, or even many a time you can say, okay, this is confirmatory of this chicken infectious anemia viruses. Macroscopically, you will find variety of lesions, but most importantly, you will also find intranuclear inclusion body. They are also indicative of this disease. But for confirmation of this disease, again you have to go for virus isolation. Then you have to go for virus neutralizing test, ELISA, PCR, or immunohistochemistry for confirmation of this disease. Right. So this is all about chicken infectious anemia virus. Thank you.